Short-term memory has three key aspects. 1. Limited capacity. Only about 7 items can be stored at a time. 2. Limited duration. Storage is very fragile and information can be lost with distraction or passage of time. 3. Encoding. Primarily acoustic, even translating visual information into sounds.
There are several different types of memory problems. There is memory loss that results from neurodegenerative diseases such as Parkinson's and Alzheimer's disease. And then there are the memory problems this project focuses on, memory problems that result from neurodevelopmental issues, and memory problems that result from traumatic brain injury.
The hippocampus, or I guess in plural we say hippocampi, the hippocampi are implicated in a neurodevelopmental disorder, and there very often will be problems acquiring new information. And sometimes that actually can be very similar to an acquired traumatic brain injury where the hippocampus or the mesial temporal lobe memory system are also affected, especially again in those more moderate or severe cases. And so I think it is good to draw at least a rough parallel between these two.
So basically, I can't remember something that's just been asked, or if we try to talk about a subject and then go back to it later, I won't remember anything about it.
Well, she can remember things that belong in a math box or a science box or a box about your muscles or a box about specific people. She'll have a box about you. She'll have a box about me. And she can remember those types of things. But if the fact is something that would be stored in a junk box, then she cannot remember it, and there's nothing that she can do to help her create that or have that junk box. It's not like if she practices or I think for certain types of problems that people have, they can do some type of therapy to get better. But I've been told from the professionals that diagnose Kelsey that there's no exercise that she can do that will make any difference whatsoever. She doesn't have that short-term memory for her junk box item.
A couple things that we might end up doing. One is we might give a test of verbal memory, okay? And that's one distinction that we like to look at is verbal versus visual memory, because they're sort of handled by different sides of the brain. The left hemisphere of the brain tends to handle verbal memory much more so than the right side, and then in turn the right side tends to handle visual or nonverbal information better. And so we give tests of both to try to look at to see if there's a breakdown or a distinction between those two. So on a verbal memory test, we might read a list of words, let's say of 10 or 12 words that we want the patient to learn. So we'll read the word, have them recall as many of the words as they can, and we might read it to them again and keep seeing over multiple trials how well they can learn, what their learning curve is like. And then what will happen then is sometime later, usually about a half hour later or so, after the patient has moved on and done some other tests, we'll come back and say, well, do you remember that list of words? And so it's seeing how well they can consolidate into their memory that new information.
In order to test for my learning disability, they had me do a lot of memory games. We literally played the game memory, where you match those cards. But we also had to give a list, like a grocery list, and then I had to repeat back everything I could remember from that list, which I could remember like the very end, and that was it. Or we had to give different names to aliens on a page, and then I had to point to the alien and say what name it was.
usually people get 100% better after a single concussion. And it's only those more rare cases where people seem to have lingering symptoms, or if a person ends up having multiple injuries, that's also not a good thing. There certainly can be lingering effects if you're having multiple concussions. But to get to your question, if we look at concussions, in other words, mild traumatic brain injuries, very often people after that will have complaints of memory problems. And those memory problems actually are measurable on our tests for at least a few days or weeks. Okay, but usually after that they do clear up. Okay, and when they don't clear up, we find that they're often, the memory complaints may not actually end up being true memory problems. When we do our tests, part of what it can do is distinguish and really show, for example, if somebody ends up on our tests actually having an attention and concentration problem rather than a memory problem. That's an important distinction because you approach it and treat it differently. What we do is we really try to focus efforts on developing in the person what we call compensatory strategies. And what compensatory strategies are really skills and habits and ways of compensating for the memory problem. It doesn't eliminate the memory problem, it's just little tricks of the trade to get around it. And a lot of these are what a lot of people already know about. So instead of trying to remember everything, to have good systems. So systems of writing things down that you need to remember, tracking information, for example, using electronics like Gmail and other email that you can search for information so you don't have to remember it. It could be as simple as keeping a daily to-do list, keeping a daily planner and calendar that you can write things down in. All those are under this category of what I'm calling compensatory strategies. So that's sort of the main way we help people deal with short-term memory problems, is to recognize the problem and then to sort of work around it.
So I write pretty much everything down, either on a sticky note, which is not always great because I tend to lose those. So I keep a lot of things on my cell phone, notes, reminders, anything that I feel like I need to remember definitely needs to be written down for me to actually remember it.
With the rising awareness of traumatic brain injuries suffered in sports and football, these issues with memory loss have become extremely relevant. One very controversial topic that has arisen is the issue of CTE. CTE is a progressive degenerative disease of the brain found in athletes and others with a history of repetitive brain trauma, including symptomatic concussions as well as asymptomatic subconcussive hits to the head. These changes in the brain can begin months, years, or even decades after the last brain trauma or end of active athletic involvement. The brain degeneration is associated with memory loss, confusion, impaired judgment, impulse control problems, aggression, depression, and eventually progressive dementia. However, the issue is that CTE can only be detected upon autopsy. Currently, neuropathologists are studying the brain and spinal cord tissue of former athletes to better understand the cause, progression, and characteristics of the disease.